please. I want you to listen to this person, a so-called nurse who is speaking to looks like appears to be a 9-month or a woman at term to give birth. And she's, instead of taken to the OB division, she's being taken to a triage where a nurse just nonchalantly, no appearance of any emergency happening here, which is a violation of protocol. All right, see if we can hear what's going on here. Okay. Speaker. Okay, I'm having problem with my speaker here. But as you can see, this woman here, she's sitting in the chair talking with her nurse. And look at that nurse. Look at her back turned to the patient. No appearance of emergency. And that is a violation of laws. It's a violation. This woman is African American. She's being violated right now by this woman who is supposed to be her nurse. No appearance as if there is any emergency going on here. Look at her back turned. Do you think this nurse ought to lose her license? I really think she should. All right, but anyways, I'm looking at this and I'm really upset about that. Okay, sorry about that. Yeah, I'm really upset about this. And this is a trend that we have seen all over, where if it's not a Black patient, it's the Black nurse, that we are being targeted and treated and abused. And so this has to be addressed. And so I started a nonprofit organization called Donna Medical Ministry International. And I am in the process of calling on all African American patients, if you need medical care, to get in touch with us. You can reach me through this. If you go into the description, you'll find a website or you will find an email. And I will post that in my video. I am calling on patients who need good medical practitioner to get in contact with me. We cannot continue to see patients abused by nurses who are being hired with no experience. This is a nurse that obviously does not know what she's doing. And she is sitting in that chair with no knowledge of her job. And it is wrong. Nurses such as her should not be entrusted with the lives of others. I am sorry, it is not. Now, I was on about 4 days ago, and I noticed that the ANA, the American Nursing Association, which I believe represent all nurses, they started to address what they call anti-Blackness. I think they are wrong to do this. I think that anti-Blackness is obviously, it's a digression from the laws. No one that is anti-Black in any nursing profession should be allowed to take care of patients. They should not be. And so this hospital, I understand that this nurse that that had been taking care of this patient here, she did the same thing with another patient who was having a seizure, which is a life-threatening event. And she did exactly the same thing. She was sitting there watching the patient. There was no intervention. Now, I wanted to also talk about, and for my female patients, I wanted to talk about what happens when a patient arrives at the emergency room and is pregnant. So there are protocols to follow. So I'm going to go over some of that right now, and bear with me, okay? Because I'm not very techy, but I'm trying to do my best here. So when a patient who is pregnant appears into or shows up in an emergency room, the mother will arrive, and the first place she will go is usually in the emergency room. The emergency room tend to have a lot of folks, okay? And so if this woman is pregnant, first of all, she should not have gone to the emergency room. She should have gone to the OB area. But it's understandable that if this person happens to be not at home and is visiting elsewhere, that's what she's going to do because the hospital doesn't know her. Her OB doctor is not in that area. So she is going to enter through those emergency room. If she does, here's what should happen. I'm going to read this off according to Google. It says protocol of any pregnant mom who shows up at the emergency room. When a pregnant mom arrives at the emergency room, the protocol involves a series of steps to ensure and well-being of both the mother and the baby. That's the goal. Is the mother okay? Now, in this, if you could see the video, it's a TikTok video, by the way. If you could see the video as I try to show it, that woman was in pain. And if she's in pain, the baby's stressing. So, number one, what should have happened is there should be a risk assessment, and that is when the emergency room team, so they should have called in the charge nurse, they should have gotten a hold of the OB team of the hospital, and so they will come in and assess the mother and baby's condition to determine the urgency of the situation. None of that was done. This includes checking for vital signs of maternal and fetal compromise. So at this point, she should be in a private room for that to be done, such as they should check for her blood pressure, making sure her blood pressure is not elevated, no shortness of breath, vaginal bleeding, acute abdominal pain, and decreased fetal movement. Communication and coordination now. So that's the next step. They should timely communicate and coordinate with obstetric clinicians. That is essential. The emergency team will work closely with obstetric clinicians to ensure that the patient receives the appropriate care and that any necessary interventions are performed promptly. Next step, emergency care. If the hospital does not have an obstetric service, such as uterine contractions or loss. Wait, I'm sorry. It says if the hospital does not have an obstetric service, the patient may be evaluated for complaints associated with labor. Can you tell she was in labor? You can, and I'm sure if you're not a nurse, you could tell that, right? She was definitely in labor. Such as uterine contraction or loss of amniotic fluid, critical conditions such as trauma, seizures, abrupture, placentae, and hemorrhage may require emergency triage and intervention. Access to care. Access to the emergency care for a pregnant or postpartum patient is not denied or delayed based on race, ethnic background, gender identity or expression, sexual orientation, socioeconomic status, language, culture. So none of these things should hinder her, not even her ability to pay should have delayed these assessment or these care. Hospital-based policies and procedures are developed in compliance with jurisdictorial regulatory agencies and the Emergency Medical Treatment and Active Labor Act calls EMTALA. So these are protocol already in place that the hospital should have followed and make sure that this woman did not sit in public in excruciating pain and prepare for delivery. Now, I was told that in the story that the woman was delivered in 12 minutes after she stood up. Can you imagine that? That this woman actually possibly gave birth while going on her way, finally possibly placed on a stretcher. I hope that had happened and they took her out of the emergency room area to a private room. 12 minutes is not enough time to prepare for delivery. So therefore, this woman most likely, she and her baby will be at risk for infection and possibly trauma for no reason. Once you get into that emergency room facility and needs emergency care, it should be like this: one, two, three. Get that woman into a room. She is 9 months pregnant. It doesn't matter who she is. She's a woman with giving with child and is about to deliver. And you, as a nurse, has to be able to make sure that your actions are appropriate, you are following procedures, and you are quick on your job and make sure that this patient is taken care of no matter how whatever. If you're knowledgeable, you call for help. There's no excuse for this, none whatsoever. None whatsoever. So, I just had to address this. I really had to address this because as a nurse, I have seen so many things that has happened to our population and of patients, and it's sad. It's sad that this has happened to this woman. It really is. And this woman looks like she was someone who took the steps to take care of her body. She was not unkempt. She came in. It was time for her to give birth, and she relied on the system, and the system failed her. So, with that in mind, I am going to ask everyone, if you or anyone that you know need medical care, we're going to do a free screening. And so we're going to base this on people who have connected with us, because we're getting ready to go out there and take care of patients in the right and proper way, patients that need care. So do me a favor, subscribe to this channel, because this is what I do. I address issues of discrimination. And this is, I should have said that this is a case of discrimination. I'm sorry. It is a case of discrimination. There is no excuse for this nurse's action. So yeah, please do me a favor, subscribe to the channel and share. And I thank you guys for your viewership. God bless you. Have a good day. Have a good evening, wherever you are. Take care.